So what exactly is celiacs again? Well, gluten-free. I can't eat wheat. Oh, okay. So like you can't eat bread. Well, yeah, bread and pasta and pizza and pretty much anything you've ever thought tasted good in your whole entire life. You're even going to find it in your beverages, alcoholic and non-alcoholic. You're going to find it in dressings, spices, dips, the list goes on. Oh, I know, trust me. But I usually blow people's minds when I tell them that it's found in makeups, lotions, shampoos and conditioners, over-the-counter pills, and prescription medicines. And at this point, people are usually like, "Are you okay? Can I get you anything?" But I don't know if it's gluten-free. Like, it's okay, it's the thought that counts. Like that one time that my grandma baked me a whole entire thing of gluten-free homemade cookies and then put a piece of bread on top to keep them fresh. I didn't tell her that I couldn't eat them anymore, but that's okay. So, like, what can you even eat? There are quite a few good gluten-free brands out there. For example, I use almost all of these foods and products on a daily basis. What happens to you when you eat gluten? First, you should know that gluten is a mixture of proteins found in wheat, barley, and rye. Once gluten is ingested, a number of things happen. The first is severe stomach bloating. The second is going to be some type of bruising. That's my leg after California. And then another thing that's going to happen on the inside of the body is the villi that line the small intestine have hair-like structures which absorb nutrients, and these become completely destroyed and wiped out, which is why malnutrition and lack of absorption is such a common problem with celiac disease. Due to the lack of absorption of nutrients throughout one's lifetime, celiac is going to have a number of side effects and symptoms, such as poor hair and nail growth, poor skin, such as acne, intestinal problems, digestion problems, joint and muscle pain. For pregnancy later on in life, there's a higher chance of miscarriage, there's a higher chance of osteoporosis, gum disease. There's just a lot of things that can go wrong with celiac, so you have to make sure that your diagnosis is correct and that you take your measures very seriously. And when all that information seems way too overwhelming to remember, which it is, there are a lot of gluten-free apps now which can help navigate ingredient confusion and restaurant safety. No, I've seen a lot of gluten-free out there in the restaurants and stuff. Unlucky for me, however, a lot of restaurants do have this clarification at the bottom of their menus that recommend that celiac patients do not eat at their restaurant due to cross-contamination of the item. Cross-contamination with celiac disease basically means that I'm not allowed to use the same toaster as my roommate, I'm not allowed to use the same jar of peanut butter once there's been a knife stuck in it, and if you flip the burger after touching the buns, I can't eat it. But the way I see it, you have celiac for life, so you might as well not acknowledge the fact that you want that piece of pizza and just make the most out of it. Happy gluten-free.